Hi, my name is Angela Martinez, and today I will be presenting my project management project. The purpose of project management is so that the informatics nurse specialist, as a project manager, uses communication, change management, and process analysis, as well as risk assessment, scope definition, and team building. The role acts as the liaison between clinicians, management, vendors, and all other interested parties. There is an importance to the organization of project management because what follows could be a discussion about how lack of planning and project management led to delays, confusion, and cost overruns. A scope involves getting information required to start a project and the features the product would have that would meet its stakeholder requirements. The work that needs to be accomplished to deliver a product, service, or result with the specified features and functions. The scope of this project is to present the option of providing parents with a tool of technology to manage evaluation of bilirubin levels on newborns who are early discharges with evidence and risks of development for jaundice. For example, premature newborns, strictly breastfed newborns, and ABO blood group incompatibility, among many other risk factors. Jaundice is a term used to describe excessive circulating bilirubin, formed as a result of the breakdown of hemoglobin, which causes the yellow discoloration of skin and sclera. A bilirubin measurement tool is utilized within the hospital for early identification. There would be a great benefit if parents could utilize a similar lower cost tool to evaluate from home. This will develop an incentive to prevent hospital neonatal intensive care readmissions. The project management purpose, if possible, is to prevent separation of the baby from the parents at an emotionally charged time. In addition, providing an opportunity for parents to be involved to prevent further higher cost complications of jaundice. Furthermore, timely identification and treatment of high circulating unconjugated bilirubin is essential to prevent kernicterus, a pathological diagnosis characterized by bilirubin staining of the brainstem nuclei. This is important to avoid the cost of readmission. This will provide a healthy outcome. What will it do and how will it function and how will we achieve this is the goal of project managing this project. As a project manager, I will facilitate the communication between the parents and medicine team to establish the expectations throughout first days of postpartum care. 4/2010 states that continued vigilance and gold standard breastfeeding support should be observed. These roles will involve personnel such as the tool innovator. So this tool innovator will be provided with a significant budget to find a tool that is less expensive than tools used within the hospital. The parent roles will use a set of parents with a newborn who is at risk for jaundice. For the project management responsibilities, first, as project manager, I will talk about the goal of the project, then I will present my timeline, and finally, I'll end on deliverable for the project itself. The project management responsibilities is to reach the goal by having an imperative attitude to initiate a plan, execute, monitor, and control the subject matter. There is no assurance that this plan will work immediately and effectively. However, it will provide an initiative for future readmissions. For the project scope and key stakeholders, I have listed a project proposal that I am going to present today. Now I will present the parties involved. The scope is to manage a tool that is lower in cost for jaundice evaluation in early stages as opposed to the high expenditure of neonatal readmissions once jaundice has exacerbated. The key stakeholders in this project will be the parents and newborn, as well as employees who can monitor, assess, and observe newborns for signs and symptoms of jaundice. There will be an estimated time frame for completion, and this estimated time frame to complete the project is going to involve a time lapse of 30 days, where we will inquire within our Great Expectations member class where future parents attend. They will get asked if there is an interest in joining the research project. I will choose 5 mothers who are 34 plus weeks of gestation. During this time, we will evaluate any expectant risk factors. Also, once the newborn is delivered, we will follow for 7 to 10 days for jaundice evaluation and implementation of tool. Using the home care model to monitor bilirubin levels will determine success. All babies must be assessed for the presence of jaundice in the first 72 hours of life and opportunistically at all contexts. The financial considerations, although jaundice was clearly visible, visual assessment should always be confirmed by other means. Some of these means will include the use of expensive inpatient tools, but the goal is to rent out the economic piece of tool only to high-risk newborns. The budget and expenditure is based solely for the use of the more economic tool. Financial strains we attempt to avoid is readmission of jaundice babies with complications to the neonatal intensive care unit. The team development, considerations, and communication project. The team that develops this project, which involves the tool innovator, the documenter of any findings, the project manager, the parents, and the newborn. Team development considerations will involve specific attainable goals, communication, and availability of resources. The risks associated with this project completion. Clinical and psycho-emotional care issues for the baby and family are raised. The risk associated with project completion can be the possibility of not obtaining a cost-effective tool for use as home care. In conclusion, my purpose through this project is to provide basic and overall understanding on how this tool may prevent newborn readmission, therefore delivering an understanding of use of resources to address multiple needs of a newborn at risk for jaundice and how to expand on this knowledge. Our plan has strong goals, a tight timeline, and strong deliverables. I want to thank you for listening to my presentation.